Imagine if you could connect to who you were before the Big C diagnosis. Wouldn't it be amazing to tap into the way you used to feel? Your feminism, your vavoom, your life, the way it was. I've been there. I am you. Let's embark on this journey towards healing all parts of you, towards creating the life you deserve and were meant to live. Sign up now to get instant access to the beginning of your transformation. You will get better. You can get your happy back. Hey ladies, just wanted to let you know that the Healing Boobies meditations are now available for purchase. There are a variety of titles available, including some that are very specific with those of us who've been through the Big C, things like fear of reoccurrence and anxiety before a checkup, and then some generalized one like being able to get a good night's sleep and decreasing our anxiety and forgiving others. So I hope you enjoy them. Just a little background about meditation. Meditation's been around for thousands of years, and meditation is our way to defrag our computer, ladies. So really what we do is we're able to shut down and bring our brain into a certain brainwave pattern that allows us to heal. So it's super important. The meditations can be purchased with or without background music. And in the meditation, in the beginning, I bring you into a comfortable position to begin your meditation. If for some reason how I am guiding you in the position that I am putting you in is not comfortable, then please, the most important thing is to make yourself comfortable. So just get into a comfortable position, because if your body's in pain, it's going to be difficult to get into the meditation. That being said, if there's a day that you can't get comfortable no matter what, still meditate. It can help. I'm really looking forward to this, and I'm hoping you ladies really, really love the meditations. Thanks so much. Talk to you soon. Bye now. Hi there. Today we're talking about neurofeedback and neuropathy. A recent study came out of MD Anderson Cancer Center, and they found a dramatic reduction in the symptoms of neuropathy, which is pain and tingling in the hands and or feet, specifically after chemotherapy treatments. This is something that of course is near and dear to my heart based on my own personal history. And there's not that many choices out there for you when you've had chemotherapy and you start to suffer with the neuropathy. There are a few medications, but they don't help everybody. And for those people who haven't responded to medications, or if medications are contraindicated, then this is a possible solution. You know, being a survivor myself, of course we're happy when the beast has been slayed, but being left with the symptoms that wreak havoc on your body and your life after chemotherapy treatment is something that is a big struggle with many survivors. So if you are a survivor and you suffer with this pain and numbness in your hands and your feet, and nothing has been able to help you, then please give us a call and we will be able to do a brain map, which is called a QEEG, to see if indeed we might be able to help you. And if you know somebody who's a survivor who is suffering with this, please pass along this information. Thank you so much. Hope you guys have a fabulous day. Bye now. Hi everybody, today we're talking about ADHD. In May of 2013, the DSM-5 was released, and the DSM-5 is essentially the book that is used by psychiatrists and psychologists in order to come up with specific diagnoses. Things like ADHD, autism, depression, anxiety. In this book is listed the symptoms that are associated with each of those conditions. So in May of 2013, they eliminated the term ADD and changed it to ADHD with 3 subtypes. ADHD with number 1 was inattention, number 2 is hyperactivity, and 3 is combined, which essentially means inattention with hyperactivity. So let's talk a little bit about girls versus boys. You've heard me talk before about how girls sometimes slip through the cracks. And this is because a lot of girls suffer more from the inattentive form of ADHD than they do the hyperactive. And if you think about a little boy who's in class, maybe disruptive and moving around, dropping his pencil, tapping his foot, that's very obvious symptoms that are destructive. But the little girl that might be looking out the window, just being inattentive, she might not really cause too much of a ruckus in class, that she might just not get the care that she needs. So it's really important, if you notice that your little girl has challenges with inattention, where you feel like you're having to redirect her, or she's not necessarily retaining the information that you're going over, she might indeed need some help. Preschoolers is also a common question I get. You know, how do you know if a preschooler has a challenge? And this can be a little tricky because, of course, some of the hyperactive behaviors that are not appropriate when you're older are appropriate when you're a toddler, right? So you really want to bring your child to a professional who can help you determine whether this is neurotypical behavior or something that might require some attention. I will tell you that most parents that I work with notice that when their child has been diagnosed with ADHD, typically older, 7, 8, 9 years old, they tell me that they knew when their child was a preschooler that this could be a challenge. So if your gut's telling you something, definitely act on it. Here we do a QEEG, which is a brain map, and this is really important for people who are suffering with ADHD. ADHD has certain neurological brainwave dysregulation patterns that we're used to looking at. 85% of kids with ADHD, whether it be combined, inattentive, or hyperactive, have a very specific kind of brainwave dysregulation. If your child has this brainwave dysregulation and has ADHD, if there's a match in that, the neurofeedback therapy can be a viable way to address your concerns. If you'd like to learn more, feel free to check out our website, which is newlifechiropractic.com. Thanks so much for tuning in. Until next time. Bye. Hi there, Dr. Carrie Chapino here. Today we're going to speak about ADHD and sleep. I hear this all the time in my practice. My child has focus problems, they have attention issues, and they just don't sleep. They either have a lot of trouble falling asleep, staying asleep, or when I go into their bedroom, their sheets are all over the place. It looks like something exploded in the middle of the night in their room. It's just that they are all over the place. They're totally not sleeping soundly. Now, there are a lot of factors that can affect children sleeping, and there's certain things that we can do to help their environment to get a good night's sleep. Things like making sure they don't have any electronics or any screens before bedtime, because the LCD screens can really wake up the brain, and that's the last thing we want. Also, we can try to really wind them down with maybe some reading, making sure they're not having any sugary foods, and also, of course, completely eliminating any of these energy drinks or caffeinated drinks that are really bad for the kids. So that's something to address. But sometimes the cause of the sleep disturbance is actually dysregulated brainwave patterns. And that's one thing that we look at with BrainCore. With BrainCore, we do a QEEG where we evaluate different parts of their brain and see where they're having any kind of brainwave dysregulation. And some kids with ADHD, in fact 85% of them, have these sleepy brainwave patterns in the front of their brain. And typically they're put on stimulant medications when the parents are choosing that for their child. And the stimulant medications, guess what? They speed up the brain, so they might really help the focus and attention. But if you're speeding up the brain, what else is going to happen? They're not going to be able to shut it off when it's time to go to sleep. And when it's time to go to sleep, guess what? When we're sleeping, our brain does a lot of cleanup. Our brain converts short-term memories into long-term memories. So having restorative sleep is super, super important. So if you find that your child has ADHD and has sleep disturbances, BrainCore might be able to help you. Come in for a QEEG, have a consultation. We'll do a complete examination, full history and consultation, and we'll be able to tell you whether or not we should be able to help. Thanks for tuning in, and we'll see you next time. Bye now. Hello, it's September and we are talking about ADHD and how to help our kids have a better school year. Very often I'll hear parents come in with challenges with their children with focus and attention, and one of the first things I recommend them to do is to do a QEEG, which is a full brain map, so I can see if I see evidence of their challenges with certain brainwave dysregulations. So when I look at the QEEG, I'm going to show it to you right here. This is the thing that we see very often, in fact 85% of the time when we see kids that have ADHD diagnoses. And this is red and yellow in the front of their brain in theta. And theta is that brainwave pattern that is associated with falling asleep. Okay, we should not have high theta waves as we're going about our normal day. We should have high theta waves as we're laying in bed trying to get to sleep. And so you can imagine this is why kids might have challenges with focus and attention, because they have too many of these sleepy brainwave patterns in the front of the brain. How neurofeedback helps is we put two sensors on their scalp and we reward their brain as they're watching a movie by making the movie bright, and they can hear it very well when they're producing higher brainwave patterns in the front of their brain, not those theta brainwaves. In the front of the brain, it's also where we have our attention areas. So areas of dysregulation in the front of the brain are a telltale problem that there's going to be a challenge with some kind of learning. So if your child is having challenge with focus and attention and you want to know if neurofeedback can help, the first thing I would recommend is get a QEEG so we can evaluate their brainwave pattern. And at that point, we'd be able to let you know if your child is a candidate. Thanks for listening. See you next time. Hi everyone. Today we're talking about adult ADHD. You know, ADHD has been around for years and years, and most of the adults that I treat now really feel like this is a struggle that they've had their entire life, and it was sort of swept under the rug, and it was really disciplined instead of addressed clinically. So instead, children were told to sit down, they should be seen, not heard. Stop with all those ants in your pants. You're not a jumping bean. Sit down and behave. And it wasn't really addressed in the sense that they had a real specific neurological challenge going on. And we've talked about neurofeedback before for people who have ADHD. And the difference between children and adults is that kids can respond really, really quickly, and they can respond quickly because they haven't had these pathways for very long. But when I treat adults, very often they started with ADHD, and then as it progressed, they can also progress into certain other kinds of challenges, like having not the best attention span, but also have developed an anxiety disorder later in life, or maybe experience some depression. And this is because when one area of the brain becomes dysregulated and it stays dysregulated for years and years, it can start to create fallout in other parts of the brain. So with BrainCore, what we do is we do a QEEG, which is a full brain map, And that brain map is able to tell me where the dysregulation in the brain is and what kind of dysregulation is present. So we talked before about how, as the brain responds to its environment, it speeds up or it slows down. And so sometimes the brain is not able to respond as well as it should. Neurofeedback helps to make new connections in the brain, allowing the brain to function in a more normal way. So yes, neurofeedback can help adults with ants in their pants, or shall I say ADHD. It can also help with challenges like anxiety or depression that kind of came along because of the chronic dysregulation that's creating the ADHD. All right, until next time, hope you found this helpful. Bye now. Hi everybody. Today we're going to talk about ADHD, but I'm going to talk about a little bit of a different presentation than we see typically. Very often I'll have a case where a parent brings their child to me and they say, you know what, my child's been diagnosed since they were little with ADHD, and we've tried medications and they've seemed to have every side effect in the book, and we just don't understand what's going on and we need help. And so very often when I run a QEEG on those patients, which again is that map that allows me to look at their different brain waves, instead of seeing the under-aroused brain that is typical in ADHD, I see something called an over-aroused brain or an excited brain. And so an over-aroused brain not only can present in the sense of ADHD in the atypical way, but also things like the child might have anxiety, the child might have tics, the child might have some OCD or compulsive behaviors, sometimes really ruminating over things. If something happens, it's really hard for them to let go. And to explain how that over-aroused brain works, it's almost like when you have a computer and you're on your computer and you have all the tabs open and you have all the circles going on all the tabs and you're trying to complete something, but you just can't because there's so much going on in the background. So that's what an over-aroused brain is doing. And that's why it looks like ADHD, right? Because their brain has all these other programs going on in the background and they can't attenuate or focus at the task at hand. So to help kids that have an over-aroused brain and have the challenges of focus and attention issues, typically what we do is we train their brain to go into the lower gears. And when we train their brain to go into the lower gears, their attention can improve because they don't have all this background noise going on. So neurofeedback can be really helpful for that population of children and adults who have ADHD and haven't responded to the medications, or especially if the medications had made them worse. Because typically stimulants are going to speed up the brain. And for 85% of kids who are diagnosed with ADHD and have an under-aroused brain, that's why you can see results with them. But for those 15% of kids who are taking those medications based on their ADHD symptoms, they have that over-aroused brain, they're not going to do as well. And that's why you see all these side effects. So if this sounds like anybody in your family or friends, please pass along this information to others. Thanks again. See you next time.